With my colleagues Maurits van Selms and Connie van der Meijden, I'm very honored to speak to this audience of the International Alliance and the ALS and NMD community. We'd like to thank the APF organization for giving us this opportunity. Oral hygiene. Why is that so important for people who suffer from ALS? It might seem obvious, since generally speaking, oral hygiene is important for all of us. Preventing caries of periodontal disease, that's disease of the gums and jawbone, well, the importance of that goes without saying. And furthermore, there's high quality evidence to support a likely association between oral health and cardiovascular disease, and between oral health and respiratory disease and others. Why is it even more important for patients with ALS to have good oral hygiene? If patients with ALS need respiratory support and tracheostomy, this may have a profound effect on the oral cavity. Patients with ALS who need mechanical ventilation may be at an increased risk of developing pneumonia, which may be life-threatening. So, paying attention to oral hygiene in ALS is important. In the case of tube feeding, however, daily oral hygiene may not always be taken into account. This may be due to resistance feelings among caregivers due to bad breath, for example, or danger of choking. In advanced ALS, it may be almost impossible to perform dental procedures such as restorations. So how to maintain this good oral hygiene? Well, the general guidelines on this look very simple. First, brush your teeth twice a day, do it for 2 minutes. Please do not forget those spaces between the teeth. Well, this is harder than it seems. We know the arm-hand function of patients with ALS may be poor or absent. The second guideline, limit your daily eating and drinking moments to at most 7 times a day. Is this hard to do? Well, actually for ALS patients it is. They need to eat and drink more often to ensure sufficient calorie intake. The third general guideline, please see your dentist regularly, is not at all that easy. Most dental practices are just not accessible to patients with ALS, if only for the design of the surgery rooms, chairs, etc. So the general guidelines hardly apply to our specific group. To investigate the problems that patients with ALS, their partners and their caregivers experience when performing daily oral care, we performed an exploratory study at ACTA in 2022. It followed a qualitative design with semi-structured interviews and video observations. Together with 2 students, we investigated 6 patients with ALS at their homes, 4 partners and 2 caregivers. This study was published in a Dutch language journal in 2023 with support from VU-Vereniging, a non-profit organization. What these interviews showed in general was that the performance of oral care is hampered by the loss of motor skills and by the gag reflex. Patients, specifically, expressed dependency on others for daily self-care. If a visit to a dentist was possible at all, patients emphasized a need for adaptations in the surgery, accessibility to a wheelchair, adaptations to the dentist's chair. And if the dentist or oral hygienist would use large amounts of water or aerosol, this would lead to gagging and discomfort. In general, patients felt dissatisfied with care. Partners and informal caregivers used various ways to help the partner or the patient with brushing and interdental cleaning. However, two partners sometimes felt unsure whether they were carrying out oral care in the proper way. And their oral care abilities had been learned in the past from their own dentist, from an oral hygienist, or from home. They expressed a clear need for professional instruction. 3 out of 4 partners indicated that an instructional video may offer added value. Professional caregivers, often the general practice nurse, provided active help with brushing and with interdental cleaning. They too expressed a need for training, for example, by an instruction movie. The video observations show that techniques varied across patients and caregivers. Sometimes too much force was used when brushing the teeth, as indicated by the electronic toothbrush's indicator lights. Often, brushing was too short, for example 1 minute. Sometimes only the buccal surfaces at the side of the mouth were brushed, and if the lingual surfaces in the middle were brushed, this could result in gagging. What this pilot study shows us thus far is that there's not one single way to perform daily oral care for ALS patients. It's important to be adaptive, to perform oral care according to the wishes and limitations of the patient. Training is required. For example, instruction videos of pamphlets may be useful. And knowing how to properly perform oral care on someone else makes it easier to do it under the changing circumstances and during progression of the disease. So far, the conclusions of this exploratory study. How to follow that up? Well, more research into these obstacles may contribute to the quality of life of patients with ALS. Caregivers should be empowered to provide this care with confidence. The results from the exploratory study could be substantiated in a larger study. Results should be disseminated into the international scientific community. The results should provide input to develop clinical and practice guidelines on how to provide daily oral care and self-care. An instructional video could be developed as part of these initiatives. Also, an e-module could prove to be a valuable instruction tool for partners and informal caregivers. Apart from research, what else has been done in the Netherlands on this? Well, the ALS Center, a knowledge platform by professionals and patients, has developed information for patients, relatives and healthcare providers. The ALS Patient Association also provided patient and relatives information by their website and also by information in newsletters. So what I would like you to take home from this is oral care and self-care for patients with ALS just need a bit of extra attention. Thank you very much.
Thank you, Michael. That was amazing. We've got time for a couple of questions. That was a bit of a shorter presentation, so if anyone's got any questions, pop your hand up, or anyone online. Oh, there's one there, over to my left.
Okay.
Hello, I'm David. I'm a patient fellow from California. I'm curious if there's advice for those like me who have ALS but are still able to take care of my own oral health. And as it changes, are there things that we should be considering doing differently that will help us have better results if and when it becomes necessary for other people to help us out?
Yeah. Thank you very much. David, it was? Yes. Thank you. So if you happen to have ALS yourself, which is of course unfortunate, it still is, it's even more unfortunate if you're not familiar with the daily oral self-care routine. And what this study showed us was that patients, but informal caregivers and partners of patients are often just without a clue of how to do it. And I would say the one important thing is to avoid risks, such as risk of gagging, or even or discomfort, or even risks of suffocating by using too much water. So this is one example of a problem or risk that arises from daily self-care or by or oral care by others who are just not familiar with ALS. The other thing is if you brush your teeth, or if your partner brushes your teeth, to pay attention and not to brush too forcefully, but to use moderate force and not to pay attention to all the teeth and the entire surface of your teeth. Some caregivers just rush over the daily routine, whereas others just spend a little bit of time for each and every teeth. Is this a kind of answer to your question?
Yes, thank you.
Right.
Is there any other question? You've got one online?
It's not really a question, it's a comment from a couple of people chiming in what they utilize. One said that they use a non-foaming toothpaste and another uses an antibacterial mouthwash, and I didn't know if that had been addressed.
Well, this was a small study with only a couple of patients and their caregivers, so there were no special measures being investigated. We have received a small stipendium from the Dutch Oral Medicine Society, or Medical Dental Interaction, it's also called, to further investigate issues. And the use of a non-foaming toothpaste is a very interesting possibility. What was the other one you mentioned?
It was an antibacterial wash. And then another person just chimed in again and said a child's small toothbrush as well they found to be successful. So it's all these wee hacks, and it sounds like a nurse might have a question.
Yeah, and it also sounds like a nurse with some experience and some practical knowledge, which may be very useful in designing an instruction video or some e-learning to get these informal and formal caregivers going, because one big finding of our study is that they just feel helpless and not too knowledgeable in practice. But these kind of practical advices may be helpful. About the antibacterial mouthwash, however, I have to warn, because in oral hygiene, the most important thing is just to use fluoride-containing toothpaste, and the mechanical brushing is very important. Antibacterial mouthwater may introduce overgrowth of bacteria and may not always have the desired effect. So this is not certain that that would be the solution.
I'm conscious of the time, but we've got a couple of hands up in the audience. I'm going to go left first.
Yeah, hi, Michiel.
We'll have to have short answers.
I was wondering if the study showed something on the usage of electrical toothbrush with regards of less hand function, arm function, or in case the caregiver has to brush for the patients.
What use is this, the electrical toothbrush?
Yeah, if the study showed anything about advantages, disadvantages of the use of electrical toothbrushes.
Disadvantage we found is if it's being used improperly, it may induce, if it's used too forcefully, it may induce loss of gingiva, the tooth flesh. So if you use it with care, it may have added value because it ensures greater oral hygiene.
All right, I've got one question over to the right here.
Well, I was just wondering about the same thing because I am using electrical tooth and so I was going to ask about that.
Oh, well, that was good timing.
But also my dentist, she lets me use a special toothpaste with extra much fluorine. Is that good or bad?
Dental toothbrush, electrical toothbrush with the last word I missed.
Yes, and my dentist recommended that I use special toothpaste.
Yes.
With extra fluorine. So I have to take it from the pharmacy. It's not bought in the ordinary shops.
Yeah. But I think the dentist gives good advice from this distance. If the special toothbrush is suited to your hands or to ergonomically designed, it may have added value. So I think that should be good advice.
All right, I've just got two more questions. Luckily, it went a bit short, so we've got One here.
Not so much a question. I'm actually trained in dental hygiene, and I studied dental hygiene as my dad had ALS, and I knew a few other people. And so one of the things that we had looked at was different types of toothbrushes, and something with a really small head worked well if you're going to do it manually. But something we really found worked best, and I worked with Philips with this, was using their ultrasonic toothbrushes, because they do seem to remove a lot of the plaque in between the teeth. And the newer ones will have a little light at the bottom that tells you whether you're pressing too hard or not. Yeah. And there's also ones with the app, which tell you which areas of the mouth you actually reach. So as a caregiver, it really is a good visual indicator of whether or not you got to all the different places in the mouth. And what we also found was, for some people, rinsing their mouth with Biotine first, so they weren't having so much excess saliva, was also a really good thing to do before you actually start with brushing the teeth.
Amazing. All right, one more, Rachel.
I've been jumping up. Oh, hello. It's more of a comment, really. I just really wanted to thank you because it's the first time oral hygiene has been discussed that I'm aware of in a meeting like this. But also just a kind of an added comment to everybody else's thoughts is that we use a suction catheter with a toothbrush on the end, which can be very helpful for all of the secretions and things. So you can clean and suck at the same time.
I know Nick can probably talk about this. Oh, yeah.
Excuse me. Would that suction with a brush be useful in their home situation?
Yeah. I know Nick, our speech pathologist, talk a lot about oral health and oral hygiene at our clinic, so I think he's pretty happy that this talk was on. So thank you very, very much. I think everyone give it a good round of applause. That was amazing.
Thank you very much.